computer. Now, I'll send you last week as well. How many of you guys were here last week? Um, type yes if you were here last week. I'm just curious with that. Okay, cool. It's a good number of you that were here last week in this discussion. And how many of you guys are here for the first time? Type yes if you're here first time, so that we can get an idea.
Okay.
Okay, Jim Klein. Okay, got it. Okay, Donna's first time. Okay, a lot of folks, you guys. Yeah, last week we cool. We got about 80 people here, and last week we started the chat and talked about, just a review really quick for those of you guys who weren't here last week. We talked about the idea of viral load. Viral load. Do you guys remember what viral load means?
Yes.
Yeah, tell us, what does it mean?
It's amount of the virus.
Right. The viral load is the amount of virus that's in our system. Yes, that's right, Sue. The amount of virus that we've been exposed to. And viral load is something that we can measure as well on a blood test. So in the same way that if you have conditions like hepatitis C or hepatitis B, we can take a blood test to measure the viral load of your hepatitis count. If you have a lot of hepatitis or not a lot of hepatitis and things of that sort. We can also measure that viral load with coronavirus as well. And so in the clinical trials that have been done on COVID-19, yes, and HIV is something we can measure viral load in. In the clinical trials that's been published, we see a correlation between a person's viral load, the COVID viral load, and the severity of illness, of how ill they get. And what we are noticing is that those who have a high viral load in their system tend to be very sick, much sicker in the ICU, and higher death rate compared to those who have a lower viral load in their system. Those with a low viral load tend to have very mild cases of coronavirus, kind of like, just a mild cold, or even no symptoms at all. Many of those with a low viral load are asymptomatic. They don't have a lot of symptoms that we see, and that's important. And the reason it's important is because the amount of viral load exposure that we have depends on how much we protect ourselves, right? And we did. Are you still here? Where are you at, Jenica? I think we did.
Here.
Hey.
Hi there.
Jenica, you're East Coast, right?
Yes, I am. So I will not be staying the whole time today, but just wanted to hop on for a bit.
Very cool. Yes. For Jenica, guys, is a psychologist. Is that right?
So I'm actually a neuropsychologist by training, but right now doing some clinical research in addition to some clinical work as well.
You're going to stand here in your underwear? I'm going to put you on the line.
Good opportunity to use that mute all button.
The beauty of Zoom.
Yeah.
The beauty of Zoom. Let me mute all, and then we can unmute you, Jenica. And so, yeah, so we had chat. How many of you guys, and you can go on the chat box here, how many of us are going through a lot of anxiety and depression in the last few months? Right? Betty, not too much. Mike, not too much. Really?
Don't be shy. Everybody's going through something with COVID.
Everyone is going through something. Uh, from the social distancing and the isolation that has occurred with that, we have seen a lot of issues with stress and depression. We have seen, guys, and the reports I'm seeing is that there's a higher rate of anxiety, of suicide attempts, of alcoholism, of drug use that's
Yeah.
associated with it.
Across the board, mental health is certainly worsening as part of, a variety of things linked to COVID, not just the fact that, people have lost jobs, but the fact that our normal support networks, our social supports, we have to stay distanced from. And this is especially true for people who are more vigorously social distancing, like those who might be more at risk, who have, multiple comorbidities and can't, rely on, family as much as they would have in the past if they were feeling low or anxious. So, it's something that is definitely one of the unfortunate after effects of COVID. And, what we're going to be talking about next week, I'll be teaming up with Dr. Trin to kind of talk a bit about, different strategies for identifying what you might be struggling with, and then some ways that you can actually help yourself, as well as when to know if you should be seeking out some specialty help when it gets to be too much to handle on your own. So we're looking forward to that, and that's going to be on Wednesday, Dr. Trin, correct?
Yes, yes. Would love to have you guys come join us. I think we're gonna do like another 6 p.m. on Wednesday, and have Jenica benefit from her specialty, which is the brain and the mind, and maybe you can give us some recommendations and advice and tips and things of that sort about this.
Yeah, absolutely. That's actually one of the reasons why I won't be staying on for too long tonight. It's my self-care night, so I'll be, taking care of myself.
Got it.
Great. Well, we're looking forward to seeing everybody on Wednesday, and there will be plenty of time to answer and ask questions. And we'll be also providing some handouts in terms of things that you can use to help figure out, if what you're experiencing is depression. So that can be really helpful for people.
Thanks so much. I appreciate it. We'll look forward to chatting with you on Wednesday. And,
Wonderful. Everybody have a great weekend. Looking forward to speaking with you.
Yes, yes.
Bye-bye.
So viral load. Viral load cannot be measured on a swab. It's typically a blood test where we can measure viral load, and it's not available now. It's done in research, guys. It's not done at the doctor's office, but we are noticing a correlation. If you have a high viral load, it's a higher risk for hospitalization and ICU and intubation and death. If you have a lower viral load, then your symptoms are more mild. These are evolving things that we are learning about COVID as we're looking at data. Almost every day I'm looking at new data that comes across. I want to chat today about, have you guys heard and have you guys read up on the fact that there are these lingering post-COVID symptoms even after somebody has recovered? Have you guys heard about that? Yeah, Clemmy says yes, Sue says yes, Mark, Laura, yes, yes. Oh my, it's more people coming in. Linda, yes. I want to explain to you, yes, some quite severe. Lelaine says brain fog. I'm curious, we have over 90 people on Zoom here. Has anyone here actually had COVID that you want to share some of your symptoms with? Or are we all so far pretty lucky with that? Good, Maria has it. Because if anyone has had COVID and want to share your experience with us, we would love to kind of hear what you have experienced, and we can talk a little bit about some of the post-COVID symptoms that I've sometimes seen among patients that have been diagnosed. I'm in the ER every week admitting patients to the hospital, and so we do see quite a bit of it. So, how many of you guys have heard of my talk before about how the virus itself, the coronavirus itself, isn't what kills you, but it's your immune system's reaction to the coronavirus that that often is what's harmful to your body. Have you heard of that before? We chatted about that, I think, last week as well, how the immune system overreacts. And in the process of overreacting, it it leads to inflammation. And in the inflammation process that occurs, it wreaks havoc on your body. Uh, so what we're going to do today is I'm going to go through different clinical trials, and I'm going to share my screen and go over it with you, and you're going to understand why that is. That Dorothy says, I truly believe I had it December 27th, but didn't get seen. It was before the publicity. Yeah, that's certainly possible. You know, a lot of folks got sick like in December and January and February before COVID was a thing. And have any of you guys were you guys sick before COVID was a thing and you're wondering if that was what you had? Like, you know, around Christmas time or January, February, because I heard that COVID was here all the way back in December and November already. It's just that we didn't have a way to detect it at the time. And so Gary says early December, yes. So I'm gonna go through real quick a scenario of what COVID does to your body. And once you understand what COVID does to your body as far as inflammation, you'll understand the research that's been published with that. Sue says, I had a lot of patients sick in January with viral pneumonia. Yes, viral pneumonia is what COVID is. And every time I'm admitting a patient in the hospital now with pneumonia, that's COVID, it's usually viral pneumonia with that. And very cool. Patricia was sick in December, didn't know about COVID. And yes. So we chatted a little bit about why initially the virus gets into your system through your nose, through your mouth, or through your eyes, right? Which is why we wear this mask, right? To decrease the viral load exposure from another person who may be sick with that. And the virus, once it gets into your system here, it travels down to your lung. It travels down to your lung. And when it travels down to your lung, your immune system sees it and says, what the heck is this? And the immune system sends the army in to try to fight the virus, right? It sends all the immune system cells and cytokines are being released and interleukins and all these inflammatory markers are released. And it creates, in this battle of the immune system versus the virus, in this big battle of immune system versus virus, inflammation is created with that. Inflammation is created in that battle. And we chatted a little bit about how when you have inflammation, you have fluid buildup, inflammatory fluid, just kind of like when you have a sprained ankle or if you had a cut in your arm, right? And in the first few minutes of that cut, that area gets swollen and red and painful and hot. right? It's because of the inflammation that results from the immune system responding to the area of injury. So when the virus gets to your lungs and it starts wreaking, issues, that immune system goes to your lungs and creates the same type of attack where you get fluid buildup and swelling and heat and all that, right? Which is why you get a fever from COVID. Fever is simply inflammation, right? And shortness of breath is from COVID is due to essentially the fluid of inflammation that builds up and floods your lungs and basically, drowns your lung cells from being able to exchange oxygen. And as a result of that, your oxygen level drops. And that's why we admit patients to the hospital with low oxygen levels. And then they end up in the ICU if it gets worse as their oxygen level keeps dropping, and then we intubate and things of that sort. So it's all about the damage that's done to the lung, guys, is really damage from the inflammatory process, that occurs during the attack of coronavirus versus the immune system. All right. Are you guys with me so far? Does that make sense? Type yes if it makes sense. Type yes if it makes sense with that. I want to make sure we're all on the same page before I move on, because we're going to move on. And do I suggest a pneumonia shot? Yes, if you're due for a pneumonia shot, get a pneumonia shot. If you're due for a flu shot, make sure you get a flu shot. Yes, yes, yes. Recommend it for all that. Okay. Now, you've heard of all these lingering symptoms post-COVID, right? It's like people are already, cured from COVID, and it's like, why do I still have shortness of breath? Why am I still tired, right? Why am I still having this or that? And if you understand that coronavirus is a virus that causes inflammation, and inflammation causes what's called vascular damage to the blood vessels. Okay, vascular damage to our system. You'll understand why people have lingering post-COVID infection. So what do I mean by that, right? What I mean by vascular damage? Well, when inflammation occurs, you have all this fluid buildup into the lung, right? Bless you, right? You have all this fluid that builds up in the lungs, and part of that fluid accumulation creates injury to the blood vessels as a result of inflammation. Do you know what inflammation of the blood vessels result in? Does anyone know? So you got a blood vessel here, right? Like an artery or a vein. The inside lining of the artery or vein is called the intima. And do you know what damage to the intima or the lining of the blood vessel leads to? Go ahead and type it out. I got you all.
Sclerosis, arteriosclerosis.
Yes, arteriosclerosis. Yes, it can lead to heart attacks, right? It leads, when you damage the lining of the blood vessel. Yes, that's right, guys. Blockage, cutting off oxygen, blood clots, vasculitis. Yes. So when you damage the lining of the blood vessel, it leads to blood clots because that damaged area gets sticky. And as it gets sticky, cholesterol binds to it and plaque binds to it, and it forms a clot. You get blood clots from it as a result of the inflammation that results from your immune system fighting coronavirus. Am I making sense so far? Type yes if I am. Type yes if I'm making sense so far with that. Okay. And why is this important? This is important because the flu does not do this. This is important because the flu virus does not create this type of inflammation. That's why it's important. It's very, very different, guys, with that. Now, how do we measure inflammation in our body? Does anyone know? Does anyone know how we measure inflammation in our body? Is there a blood test or something? Yeah, C-reactive protein, white blood cell, ESR, right? Sedimentation rate, CRP. You guys are a smart group. Holy moly. Yes, yes, yes. The ESR level, erythrocyte sedimentation rate, or the CRP, which is the C-reactive protein. These are two blood tests that can be, these are two blood tests that can identify inflammation in our body. So let me ask you, if I were to admit a patient in the hospital from COVID, and I check their C-reactive protein, and their C-reactive protein is, let's say, normal C-reactive protein, what does that tell you about the inflammation of that person that's been, attacked with COVID? Is it high or low? If I check that patient in and I check their C-reactive protein level, that's right, it's low. That's right. And if I admit my patient with coronavirus and their C-reactive protein is high, what does that tell you about their inflammation levels from COVID?
Not good.
Which patient has a worse prognosis?
Higher.
With the higher number.
That's right. The patient with the higher C-reactive protein will have more people are coming, will have the worst prognosis. Does that make sense so far? If you have more inflammation, it means you have more damage, right? It means you have more clots, right? It means you have more clots in your system. Now, if you have blood clots because of the inflammation that occurs from coronavirus, the diagnosis we give patients depends on the location of the blood clots. If the blood clot from coronavirus that's being created because of inflammation, if that blood clot went to my brain, what's my diagnosis? You can type it out. That's right. That's right. Stroke, CVA, cerebral, yes, stroke, cerebral vascular attack, CVA or stroke. That's right. And let me ask you this. If that blood clot from the inflammation caused by coronavirus occurred in my heart, what do I call that? Occurred in the coronary vessels. What do I call that? A heart attack, according.
Heart attack. What else?
That's right. You guys are good. You guys are good. Have you read somewhere that people are getting heart attacks and strokes from this? Right? Do you understand now that I've given you a background of how coronavirus damages the body? Do you kind of understand now why these other conditions have been connected to coronavirus? You've heard about, strokes and heart attacks and like, what is this? It's like, I thought this was the flu, right? I thought this was like a serious flu. What are you talking about, strokes and heart attack? Are we misdiagnosing patients, right? Are we just blaming like a stroke on COVID, or are we just blaming a heart attack on COVID, or are we just blaming, pulmonary embolus, which is a blood clot in the lungs, on COVID? Are we wrongly blaming everything on COVID, right? And you've heard that argument as well, right? That we're just blaming everything on COVID and we shouldn't blame everything on COVID, right? So so I wanted to make the connection with you of why that is. And the question is, why are some patients at higher risk for being sicker than other patients? Okay. Why are some patients at higher risk for having more inflammation than other patients? Does anyone know why some patients are at higher risk for more inflammation?
Poor immune
Yes,
system.
absolutely correct. Poor immune system, or they have underlying
Line
inflammation,
conditions.
right? They have underlying inflammation already, right? From diet, from lifestyle, right? Diabetes is an inflammatory disorder. You know why? Because sugar is pro-inflammatory, right? So if you're already having underlying inflammation because you have a lot of sugar in your system, you know, and the scary thing is, you know, 2 out of 3 Americans are either diabetic or pre-diabetic, which means 2 out of 3 of us already have underlying inflammation, right? Sandra says, even young people in their 20s who are not overweight, right? So yes, so let's go look now at, now that I've given you a background of what this looks like. Oh, there's more people coming on. Let me admit them. We're gonna have 100 people here soon, guys. So now that I've given you a background between inflammation, right? Between inflammation and blood clots and the associated symptoms that are due to blood clots, right? If it went to your brain, then it's a stroke. If it went to your heart, it's a heart attack. If the blood clots occurred in your lungs, we call that PE, pulmonary embolus, or it can occur in your legs. We call that DVT, deep vein thrombosis, blood clots in the legs, and things of that sort, right? So COVID is nothing like the flu. COVID is a vascular problem that results from inflammation, that leads to all these different symptoms that occur with that. All right, are you guys ready to see some research? You guys ready to see some research? All right, let's take a look here. I'm gonna share my screen and we're gonna go to where I uploaded some research. With that, let's see here. Share screen. Oh, okay. Can you guys see my screen now? Okay, let me open up the chat box on the side. Cool. All right. Let's go and open up some stuff here. I'll pull up the chat box on the side so that it'll be up the whole time. Oh, there's more people coming in. So Susie wants to know where I got my nice mask that has good coverage. Are you talking about my Walking Dead mask, Susie? Do you like this mask? Did you want to buy a Walking Dead mask? Is that what you wanted to buy, Susie? Because this is my favorite mask. It's the Walking.
I like it, and I also like the coverage. It's more coverage than the mask, the cloth mask that I bought. So,
oh, great.
And of course, The Walking Dead isn't bad either.
You're my favorite person today. The Walking Dead is not bad. Yes, we'll do a Walking Dead chat sometime. But anyway, I'll send you a link on where I bought it with that. So let's go to some research. We're gonna open up. I'll tell you where. This is my my Facebook account, by the way. I'll tell you where I compiled my research, so you can always go look on there. It's in the Longevity Club. And let's see here. I posted a good number of research in there. And under units, so if you have Facebook, you can go to Longevity Club. Oh, there's more people coming on. And we're going to go to units. And let me see, ketosis and cancer research, ketosis, obesity, intermittent fasting, ketosis exercise, brain function, Alzheimer's, recipes. Here it is, COVID published research. Let me click on that. And you guys can see all this, right? And okay, I want to make sure the chat box is open on the side here. Let's look up a few things here. First thing you should know is that our immune system has two types of immunity. We have all heard about antibodies, right? Everyone's heard about antibody immunities. Have you guys heard of T cell immunity before? Has anyone heard of T cell immunity? Yes? No? This is a report. So T cell immunity is also part of your immune system, guys. So the B cells creates antibodies, and the T cells has its own type of immunity where that also remembers the virus, sometimes much longer than the antibodies. So we have learned recently that the T cell immune response can last up to at least 6 months. So that's good news that that if this is true, that you'll have at least 6 months of immunity from COVID if you've had COVID and you recover from COVID. Okay, with T cell immunity. This is an interesting study that I saw recently, guys, and I want to show you this here. And it's in the New England Journal of Medicine, and the title is Pulmonary Vascular Endotheliasis Thrombosis. So it's a lot of mumbo jumbo. The only thing you need to know is you see COVID-19 here, you see pulmonary, it means lungs. Vascular means blood vessel, and thrombosis means blood clots. Okay, so COVID-19 causing blood clots in the blood vessels of the lungs. Does that make sense for you guys? Right, this is a original article recently published. And what they did, guys, is they did autopsies of 7 patients who died from COVID, and they compared it with autopsies of 7 patients who died from the regular flu. Okay, so you got 14 lungs, and autopsies were done of 7 patients from the flu and 7 patients with COVID. Does that make sense so far? Type in yes if it does. Cool, okay. And there's a lot of mumbo jumbo that I won't go through the details with you, but I want to give you some final conclusions that are really important here. So this sentence here that I'm underlining here is that capillary microthrombi. Microthrombi means blood clots, okay? Blood clots in the blood vessels were 9 times more prevalent in COVID-19 patients than the flu patients. So what I'm saying is that this is nothing like the flu, guys. This is nothing like the flu. COVID-19 patients develop blood clots 9 times more prevalent than patients with the flu in their lungs when we did autopsies. So we did autopsies of their lungs, and there's nothing except a bunch of blood clots that are noticed in the lungs of COVID patients with that. And the point is this. And the point is this. If you develop blood clots in your lungs at the extent of 9 times more than any patient having the flu, even when you recover from COVID and you survive COVID, right? Oh, we have our 100th participant joining us, right? Even if you recover from COVID, do you think the blood clots immediately just disappear? That's correct. Does it make sense why people who have recovered from COVID months ago, does it make sense that they say that I'm still, short of breath often? I'm still very fatigued. Do you think it's possible that those blood clots have never completely disappeared? This is post-COVID syndrome, isn't it? The damage was done, right? The damage was done, which is why the symptoms still linger, right? Did anyone see a study recently that was just published that states aspirin helps with COVID? Did you guys see that? Type in yes if you saw that, right? Yes, there was a study recently that says aspirin helps with COVID, right? Does it make sense now why aspirin helps with COVID? Now that you understand about blood clots, right? It's the same reason you take an aspirin for a heart attack. Same reason you take an aspirin for a heart attack, right? So let's move to the next study here, and we'll just go over study after study for you guys here. So we'll close this one. We should look up that study with aspirin. Let me see. Oh, here's another study. This is an interesting one. This is, let me pull it up here. November 6th, which was a week ago, right? Yes, Patricia, we often give blood thinners to patients who are admitted with COVID in the hospital. It is often a routine to prevent all these blood clotting issues. This is an interesting one. Everyone knows what CRP looks like now, right? What this means. Levels of CRP during the first 48 hours of hospital admission predict respiratory decline in patients with COVID. This was last week's report. Does this make absolute sense to you now that you understand the inflammation behind this? Type in yes if it makes sense, or if you need me to explain that some more for you, right? CRP is a blood test that measures the level of inflammation or of damage that's caused by COVID. And so in this clinical trial, they check CRP levels in every patient with COVID, and they determine that the higher the level, they can predict the worse you'll get, right? The worse you'll get with that. And so that's, I don't have to go through the entire thing with you, but this is what they do now to determine your prognosis, when we first admit you to the hospital, is we check the CRP level to determine how much inflammation there is in your system from COVID. And we can predict if you're somebody who may end up in ICU or not with that. So that's another study. What is this thing? Oh, this is an interesting one. Relationship between Journal of Nutritional Health and Aging recently published. The relationship between dietary factors with infection and mortality in COVID around the world. This is a very interesting one. And essentially what they concluded was that, let me take a look here. They looked around at various countries. This is a World Health Organization database, 158 countries. They looked at dietary factors in 158 countries to try to predict a mortality rate. What's your chances of dying? And And what they've shown is that sugar sweetened beverages had a positive effect on infection and mortality. Positive means higher rate of death and mortality compared to countries that ate more beans and legumes. Isn't that interesting, guys? With that. Now, I'm not saying that you shouldn't eat fruits. I think what they're referring to is sugar in general, right? Sugar sweetened better, sugar in general. And we've talked about how sugar is pro-inflammatory, right? And they done this study was an association between dietary factors in different countries and mortality rates with that. So if you're in a country that had a lot of sodas and a lot of sweets, AKA USA, right? Your mortality rate is higher than in countries that that ate more of a Mediterranean diet, which is like legumes and beans and things of that sort. This is more of a Mediterranean diet versus a diet full of sugar. And does it make sense now that you understand that sugar is pro-inflammatory? Right? Sugar leads to inflammation. Inflammation, an increased baseline of inflammation makes it even worse when you get COVID because you're throwing inflammation on top of inflammation, right? And so that's a very interesting. So somebody here says I need to cut back on my wine. All right, Jim. Yes, sugar seems to impact everything. Clemmy, and coffee is loaded with sugar. I just do black coffee, Clemmy. All right, let's go to the next study here. Yeah, I just like bringing data, and I complex data, and I want to break it down to you guys to just regular words and terminology, so that you understand what's going on with that. Let's do a search. Let me see. Let's just do a search on, let's say, COVID and heart attacks. Right? Let's just do a search on COVIDs and heart attacks with that. Here it is, WebMD, COVID can trigger serious heart injuries. Does that make sense to you guys now, why COVID can trigger serious heart injuries? COVID-19 can mimic heart attacks. Does COVID-19 cause heart damage? COVID-19 linked to heart damage in healthy people, right? Now you know why, right? Because of the blood clots that are induced by inflammation that are induced by COVID infections, right? Linked to heart attacks. Now you know why. 3/4 of recovered COVID-19 patients had signs of lingering heart damage months after their initial infection. That doesn't sound good. Oh my word. This study was published in the Journal of Cardiology, JAMA. 100 adults aged 45 to 53 in Germany who recovered from COVID. 1/3 require hospitalization. The other 2/3 recovered at home. And apparently MRI scans done show signs of heart abnormalities, including inflammation of the heart muscle. Now you understand inflammation, right? So inflammation causes blood clots because inflammation again damages the arteries. And when the arteries get damaged, then it becomes sticky. And when it becomes sticky, the blood clots form. Making sense? And if it gets sticky and forms to your heart, it causes heart damage. Let's look up, let's do another search. Is the vascular damage permanent? It is too soon to know because this virus has only been around for a few months. So we don't know. We don't have that data on this is long-term or short-term with that. Let's look up COVID and stroke. Oh, this is interesting. Clots strokes, and rashes. Is COVID a disease of the blood vessel? Yes or no, guys? Right, this is 2 hours ago here. Yes. And so very, very interesting. Let me take a look here. Check this out. What is this? This is WebMD. Stroke is 8 times more likely with COVID than flu. Does it make sense why stroke is 8 times more likely with COVID than flu now? Right? Blood clots, inflammation, blood clots that occur in the brain, right? So it depends on where the blood clots occur. Oh, there's more folks coming in. Depends on where the blood clots occur is where you see the damage. So this study, both flu and COVID can raise your risk for stroke. The odds appear to be 8 times more coronavirus, a new study. This is a study in 1,900 patients with COVID. 1.6% suffer a stroke versus 0.2% of 1,500 patients with the flu with that. So it's a 1.6 stroke risk versus a 0.2 stroke risk. COVID versus flu. Oh, more people coming in here. And so that's, so there you go. Now you know why. This was Cornell Medicine, New York City. Is where they did their study in New York here with that. So that's interesting. What else do you guys want to look up real quick here? What about blood type and COVID? Is type O more protective than type A? Sandra, I have seen a few reports, but the reports are too preliminary to really draw a conclusion because the studies were not large studies where it was done with thousands of patients. So why do people lose taste? Does anyone know? Why do people lose taste and smell? Does anyone know? Does anyone know why you can't smell or taste? I mean, it's a great weight loss program. You have COVID. I mean, you're not hungry for anything. You can't taste anything with that. The nerves that affect taste and smell, right? It's brain related. It's brain related. And so we have seen COVID enter and affect our brain, right? And affect our brain. We call it post-COVID brain fog. Brain fog. You guys have heard about that? Folks are like having difficulty with concentrating or with memory. But you have brain fog because some of that inflammation went up here. And that inflammation that goes up here goes up the olfactory nerve, which is the nerve that deals with smell, and it's a portal of entry for COVID when COVID enters here. And so when it goes up the nerves, it causes inflammation that affects your ability to smell and taste. Does that make sense so far? Right? COVID goes up the brain, causes brain symptoms. So now that you understand inflammation, COVID causing inflammation and blood clots, now you can pretty much name all the different potential post-COVID symptoms that people get, right? Fatigue, shortness of breath because of all the micro blood clots that have never resolved, brain fog because of inflammation that affected the brain, right? We saw some report about heart disease or heart inflammation, right? These are all post-COVID symptoms. And it's like, why am I still having symptoms when I've already recovered from COVID? Well, it's because the damage was done. the damage was done. That's why. And so the good news is that COVID deaths is probably under 1%, right? If you actually take all the COVID cases we have in the country, my guess is the death rate is under 1%. That's good news, right? That's good news, under 1%. The not so good news is we just don't know how long these post-COVID symptoms last. And we don't know yet, Isabel, if they're permanent. Why don't we know? It's because it's too soon. COVID just started in March. And so it's too soon to know if they're permanent. We just have to wait and see, right? And see if your body recovers from it with that. Because this is a new virus, we don't have the long-term data to know if it's permanent or not. So it's kind of good news, bad news. The death rate is under 1%. Yay, I love that. But you're seeing like over 100,000 cases now a day in the United States. I think yesterday it was like 150,000 or something like that. These are like crazy numbers now that we're looking at, right? If you imagine that, 100,000 cases a day means in 10 days, 1 million Americans have been affected by COVID. In 20 days, 2 million Americans have been affected by COVID. Right now, I mean, the graph is like exponential now. We're talking about millions per week, as opposed to, how long it took us to get to the first million in the United States. It took us a lot of months. But if you're doing 100,000 new diagnoses a day, it doesn't take long to 1 million. And although most of us will survive, 99% plus will survive, I just don't know about what's going to happen with the long-term post-COVID symptoms. But I wanted to bring to you guys this attention that post-COVID syndrome does exist. And now when you see the news, when you see the journal articles, now you know why. Because now you can connect inflammation and CRP levels and viral load and blood clots. Now you can make all the connections, right? When you see the news with that. And what constitutes long-term data when doing research? Yeah, long-term data is definitely longer than a few months. Yeah, when I think of long-term data, I'm thinking of years with that. A few months is not long-term data at all. And we've only done this for a few months, guys. Vivian says, will it go away if it's treated? Well, I mean, most of us who have COVID have already recovered from COVID. When I say recovered, I mean the virus is gone. The question is, will the symptoms go away? Will these blood clots go away? And I think most patients are probably okay, especially if you're healthy or if you're young, and and it comes and then it goes completely. But there are some who still have lingering symptoms. Isabel says 2 of my family members have had COVID-19 and have experienced some of these post-COVID symptoms after months. Yes, Mark, the death rate is low, which is great. Clemmy says, are there parallels with SARS post-viral symptoms with that? SARS have never reached us back in 2003 or something like that. We don't have a lot of data in the US on SARS to look at the parallel. All right, you guys got that questions now on vaccination. Okay. So let's talk about vaccinations real quick, okay? Steve says, does taking zinc help? Yes, zinc helps the immune system. Vitamin C helps the immune system. Vitamin D helps the immune system. Exercise helps the immune system. Getting enough sleep helps the immune system. Getting some sunlight every day helps the immune system, okay? You know what doesn't help the immune system? And none of us think about this? Depression doesn't help the immune system. I've seen a lot of studies on patients who are depressed who tend to get sicker than others. Depression doesn't help the immune system. Yeah, if you guys can make it next Wednesday at 6 p.m., same Zoom link as this one, next Wednesday at 6 p.m., I'm going to bring Jenica, who spoke to you guys earlier, on. She's a neuropsychologist. You know, it sounds kind of scary, neuropsychologist, right? But she's like an expert on mental health, behavioral, and she's going to give us some really good advice and some practical tips on addressing mental health issues. We'll do that next Wednesday with that. Yes, stress does make everything worse. Is depression a possibility of why some young people are dying? I've seen a higher rate of suicide attempts among young people in the last few months. And yes, it's due to depression. It's due to job losses. I mean, imagine that. How many jobs did we lose? We lost millions and millions of jobs. Millions of businesses were affected, right? The shutdown and everything else. And if you can't pay your bills, imagine the depression and the stress and the anxiety that is associated with this pandemic, including young people and old people, right? And super important with that. Young people typically do not die from COVID. Rarely you'll see it because their immune system is strong and healthy with that. So let me chat real quick with you guys about the vaccine. So everyone's heard about Pfizer, right? This past week. Pfizer is one of 4 pharma companies that have vaccines in phase 3 clinical trials. Phase 3 clinical trials is the last phase before FDA approval, right? Before FDA approval. And so we have 4 companies in the US that are in phase 3. These 4 companies are closer to FDA approvals than other companies. There's probably 10 vaccination studies going on right now throughout the world. In the United States, it's 4 of them, okay? Most of the vaccinations I've seen, they're 2 shots. It's not a 1-shot deal like the flu shot, right? You get it once and then you're done. A lot of these vaccinations, they're 2-shot deals separated by 3 weeks apart. So you get a shot now and then 3 weeks later, you get a booster, okay? So Pfizer announced that they had a 90% success rate. Very interesting, isn't it? 90% success rate. So what does that mean, right? What does that mean? First of all, you should know that in Pfizer's study, they enrolled 43,000 patients in this study. 43,000 patients, a lot of patients, right? In this study. So that's pretty good. I mean, it's better than doing, 100 patients and giving data on that. So there's 43,000 patients that are going through this vaccination studies. Half of them took the placebo shot, which is like a sugar pill, right? A placebo shot. And the other half took the real shot, right? The real vaccination. And what they did was that the information they presented this past week is preliminary data. Preliminary data means it's not the final data, okay? It's preliminary. And it's a preliminary assessment. And in this assessment, they looked at 94 patients who developed COVID infections who were part of the study. So these 43,000 patients all got their shots. They got 2 shots, and then they continued to live life. And 94 of them, 94 of the 43,000 got COVID, right? Okay. And so of those 94 patients that got COVID, they looked at the data and they determined, the way they determined that was 90% successful is that they must have looked at the data and realized that the majority of these 94 patients were probably in the placebo group where they didn't get the real injection. And maybe 10%, right? Maybe a small amount of those 94 were the ones that got the real vaccination. And that's probably how they concluded that data. Does that make sense to you guys? Does that make sense to you guys? They give you the shots and then they wait to see who got COVID. And then they unblinded, right? They unblinded the data and they looked to see how many of those 94 were in the placebo group and how many of those 94 were in the real injection group, the real vaccination group. That's probably how, I'm assuming that's how they got the data, because I'm thinking that's the only way they got that 90% conclusion, right? It's preliminary because their goal is to wait till 160 something patients get diagnosed with COVID. So they're still waiting and counting as more patients get diagnosed with COVID, right? They're waiting for 160 something patients to get diagnosed, and then they're gonna really look at the total data to draw their conclusions. Clemmy says, did they also wear masks or not? So Clemmy, they just went to live life, right? They didn't tell them that you have to do this or that after the vaccination. They just continued to live life. So here's what you should know though. There are some questions that we need to ask Pfizer about this study that we don't have information on yet. The first question we need to ask is, how long is the protection going to last from the vaccination? Right? Is this a vaccination that's going to last a year? Or is this a vaccination that's like the tetanus shot that's going to last 10 years? Or is it 2-3 years? Or is it like, MMR, right? When you're a kid, you get it and then you don't have to do it when you're an adult, right? How long is this vaccination going to last? We don't know. We don't have that answer yet, but that's what I want to know. I mean, wouldn't you want to know if you have to have 2 shots for something? I mean, it wouldn't be fun to have 2 shots of something every year for a vaccination, right? I mean, think of the logistics of it with that. So that's question number 1 we need to ask. Question number 2 that we need to ask Pfizer is, what is the breakdown of the demographics of these 94 patients? Were they older patients? Were they younger patients? Were they patients with diabetes? Were they patients with, obesity? Or were they healthy patients? Right? And so what is the demographic? Because we want to make sure that the vaccination is going to protect the most vulnerable of us. Right? We want to make sure that this vaccination is going to work on patients who are more vulnerable, diabetic patients, older patients, patients with chronic diseases, with that. And so Maria says, how would they know how long when we're in the early phase of the disease? Yes, I'm thinking, Maria, the way they determine how long this vaccination protects you is I'm assuming they're going to look at antibody levels that are created, right, from the vaccination. And they're going to look at the half-life of these antibodies. How long does the antibodies last? Does the antibodies last and stay sustained for a long time? Or does the antibodies build up and then go all the way down real fast, right? If your antibodies go up from the vaccination and goes down really fast, then the vaccination doesn't protect you long term. But if your antibodies go up and stays up long term, then the vaccination will probably help you, for quite a while. Does that make sense so far with that? So question number 1 is, how long is this protection? Question number 2 is, does it protect the vulnerable? Right? Because if this vaccination protects only kids or only young adults and doesn't protect the vulnerable, then what's the point? Right? We want to make sure that this vaccination protects the most vulnerable in our society. That's question number 2. Question number 3 is this. Question number 3 is, how's this actually going to be delivered to all 350 million Americans? It's one thing to have a vaccination that gets approved. It's another thing to have the logistics and the infrastructure to actually give the shots to everybody. And the reason I say that is because this vaccine requires it to be stored in negative 100-degree refrigeration. And so I don't know if you're like me, but I don't have a refrigerator that goes to negative 100 degrees. And I doubt if, you know, CVS or Walmart currently have a refrigeration that goes to less than, you know, negative 100 degrees refrigeration. So there's a lot of logistics behind this. So it's one thing to be approved. It's another thing to, you know, have the logistic to deliver. I know that Pfizer will have 15 to 20 million doses ready in December to be delivered. And so they're ramping up. By the way, they're not even FDA approved yet, guys. So they're seeking the emergency, you know, approval from the FDA over the next few weeks. So I'm thinking by the end of November or something like that, then it'll be approved. Lalaine says, what are the risks and side effects? Great question. So we know that to get to phase 3 clinical trials, you need to go through phase 1 and phase 2 first in clinical trials. In phase 1, Lalaine, in phase 1 of our clinical trials is when we assess for safety. We assess for safety in phase 1. We check we do the shots on healthy patients and we look at safety data. And it needs to be relatively safe for it to move on to phase 2. Right? We need to know that you're not going to grow a tail or, you know, have a third eye or something like that or drop dead before you get to phase 2. And holy moly, there's still people coming and it's like 7:15. And so in phase 2 is where we assess for dosing. Is it going to be 1,000 milligram dose or 5,000 milligram dose or whatever dosing that is, right? We look at the right dosing in phase 2. And we continue to check for safety in phase 2. We continue to check for safety in phase 3. But so far, the next analysis that Pfizer is doing is a safety analysis. In the next few weeks, they will announce their safety analysis of their vaccine. So the information you got from Pfizer a few days ago is an analysis on if it works or not. The next information we're waiting for is the side effect analysis, right? So Pfizer should be announcing that sometime soon, safety and side effects with that. Steve says frozen for transportation and has to be warm slowly prior to injection. Yes, absolutely correct. Because we can't inject something that's negative 100 degrees into your body because you'll be like the Iceman, you know? It goes in here and like you're like frozen because it's so cold. So yes, absolutely correct, Steve. Lynn says, I heard that proper refrigeration units are on back order, so pharmacies are worried about getting them. Yes, absolutely in back order. I mean, you know, we have 350 million Americans to give the vaccination to, and obviously there isn't enough refrigeration, and yes, they're in back order. So yes, I think we're gonna have, assuming that the government approves it, we will have at least 15 to 20 million doses for December. And then in January, they'll have another 20 million doses in February. So they'll continue to make more doses every month to give out to folks. Let me ask you real quick, guys. If the vaccine from Pfizer gets approved today, say yes or no. Will you get it or not? Tina says no. Mark says yes. Yes, yes, no, no. Maria says no, no, yes. Holy cow. Steve says no. Carol says no. Undecided. Frida says no, 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 no. Okay. Holy moly. They're doing all this work to get a vaccine and nobody wants the vaccine now. All right. No, I totally understand, guys. Land says, as long as you do. Great. When it's safe, we'll wait. If others are vaccinated, not yet. Well, it's going to be free, Christina. It's going to be free, according to President Trump. He says that the government will cover it. Steve says not until the side effects are known. All right. Sandy says, what about you, doctor? Well, Sandy, my answer is that I'm going to wait till Sandy gets her shot first, and then I'm going to decide after that. Isabel, do you think there's enough resources available to people affected by COVID in all areas of life? Yes, it's affected so many people. Yes. Lynn says, I definitely need it. Yes, yes. Very cool. So, guys, it's 7:19. I can't believe an hour and 20 minutes has gone by already. It's pretty crazy. Betty says, what's my opinion of COVID-19 trials? Yeah, I am still processing that right now. I'll see what Dr. Fauci says, right? Clemmy says you get side effects, everything. Susie says, I need to know preservatives. Yes, some of you guys have been worried about preservatives with aluminum or mercury and things of that sort, right? Maria, Dr. Maria, can you talk a little bit about preservatives in vaccinations since you're a pediatrician and you do a lot of vaccinations? I want to hear your thought on that. If let's see, is Dr. Maria able to unmute?
What, yeah, what did you say, Dr. Trin? I didn't hear you.
Yes, so since you're a pediatrician and you do a lot of vaccination in children, right?
Mm-hmm.
There are concerns about preservatives that are in vaccinations. I've heard about like mercury or aluminum or different things. So some folks are concerned about the possible side effects of vaccinations due to preservatives. And I want to get your thought on that.
Right. I have not seen or I've heard about those things, but I'm a firm believer in vaccination in children. I have seen where we used to be having all the polio and whooping cough and tetanus and those things. We don't see those things anymore. Measles, we don't see those things anymore. And that has all become because of the children have been vaccinated. So I'm a firm proponent of vaccination. However, my main concern is issues related to safety and to ensure that these things are properly analyzed before. I am not of the view, to tell you the truth, that, well, put it this way, I'm not minimizing the effects of COVID, but I'm saying that there are ways right now that you can present yourself from COVID. It's not that it's inevitable that you get it. So I am saying until such time as you get a vaccine that I am confident that it will protect me against COVID, I will use the protective features that we have right now. And of course, pray that I don't get it. But I'm not going to run to get a vaccine so that I can continue on my merry way and don't do things like hand washing and mask wearing and all of that. So this is how I see this thing right now. Dr. Trin, I'm not running for a vaccine that I am not sure of the efficacy.
That's
Mm-mm.
awesome. Thank you so much for your thought. And I share that thought. I will, if anything gets approved, I will look at the data very carefully first. And of course, once we hear of a vaccine approval, what we ought to do is we should all come back here on Zoom, right? And chat about it. And chat about the details and go over, the pros and cons and things of that sort, and discuss it, and we can kind of go from there, because I'm sure the data will be published and the details of the data will be published, including the side effect data that will be published as well, and we can chat. All right, guys, did you learn something today? So very cool. Very cool. I wanted to give you the science. Once you understand the science, then you understand the news and you understand, the link between heart attacks and strokes and post-COVID syndrome and brain fog, right? Once you understand the science, once you have that baseline core science, then everything makes a little bit more sense than before. So, so you guys take care. It's Friday the 13th. Ouch. If you're interested, I will be here next Wednesday night at 6 p.m. Put it on your calendar. It will be the same Zoom link at 6 p.m., same Zoom link next Wednesday. And we're going to chat about mental health and addressing mental health and stress and anxiety during these times. And I think it'll be very important with that. So, and I will send you a link. I'm going to go ahead and put this all on YouTube, and I'll send you guys a link of both videos, okay? For those of you guys who did catch both. All right, well, God bless, and enjoy the rest of your Friday.
Thanks, Dr. Tran.
All right,
Thanks very much.
take care.
Thank you so much.
Thanks so much.
Thank you.
Aloha.
Be
Aloha.
safe. Aloha.
Thank
Are you
you.
in Hawaii? Aloha.
10 years.
Awesome. Hello from Hawaii.